Assalamu alaikum. Viewers, I would like to welcome you to another session from Special Child Care. And you know that, after a short break, we're starting again. Last from 2nd to 12th of April, we had a series of programs to mark the month of autism awareness. And now we are having the next session today. And today we have with us a Professor Dr. Murali Krishnan. He's a professor at Faculty of Occupational Therapies at Therapy at MAHER in Chennai. Dr. Murali, I would like to welcome you to our session today.
Thank you so much, Dr. Syed.
And thank you very much for joining. This is the third session with you, and thank you very much for giving us time. And you know that we are going through a very difficult time, and the world has been shaken again by the second wave of COVID-19, and entire world, especially recently in India, we see a huge surge in number of people infected and died. People are dying for the shortage of oxygen and other, especially in Delhi and other places. We are really shocked, at this news, and we are also afraid. And also in Bangladesh, it's rising the cases of corona infection. And all these things, today's topic is also related to this pandemic, because we know that, even in Bangladesh, we have a very serious lockdown, and all the schools are closed, the therapy centers are closed. And for the second time, as we had in the last year, our children, our kids are at home. And this is a big challenge for parents. This is a very big challenge for parents, because as a parent, I know it's very difficult to keep our children at home, especially when there is no school or therapy center. Now, again, the role of family, the role of parents come up, like how should we manage? Because when the situation is normal and our children can go to school and therapy center, somehow we manage it, the whole management protocol, that a few hours of the day they are with the professionals, but once again they are completely at home. And many parents, and parents means us, including me, we don't know how to deal with our children. Many parents don't have that setup at home as they really need. Right now, we need to know how to deal with them, and we need to know how to use our available resources to keep them busy, because we need to give them quality time. It's not like enough to just sit with them, or just let them do whatever they like. So Dr. Murali, as you decided today's topic, that family's role on improving child's participation in those kind of activities for development. So I would like to welcome you to the this discussion, and I would like to request you to introduce the topic today, as you have.
Thank you, Dr. Syed. I'll go with the screen sharing.
Sure, please.
Okay, Dr. Syed, shall I proceed?
Yeah, sure, please.
Hi. Very good evening to one and all there, one and everybody there from Bangladesh, and all the parents with special needs. Today, the topic we chose to talk is on the role of family in improving child's participation. When we were discussing on what topic should we go ahead for this, we had 2-3 topics in our mind. One is home plan, one is on core muscle strengthening, one is on reducing hyperactivity. But all this, whatever the topic you take, whatever the component you take, anywhere and everywhere, one integral factor which comes into the picture is the family. If you don't have the family's contribution, if you don't have the family supporting the whole therapy system or the rehabilitation process, the rehabilitation process itself is nullified there. That is, it goes into waste. Just a clarification, Dr. Syed, is English okay or we will shift to Hindi?
No, I think English is okay, but you can use a mixed one as well, like Hindi and English, no problem.
Yeah, please just let me know whenever you want me to change it.
You want to do the whole thing in Hindi? Okay, okay, go ahead, no problem. Actually, language is not our problem because many people understand Hindi in Bangladesh as well. This is true.
Okay, they get English, right? So I'm not so good in Hindi, that's why.
But I apologize that I'll be speaking in English maybe because my Hindi is very poor. So you can speak in Hindi, no problem.
Okay, right. So, first on the onset, the importance of family in bringing a rehabilitation process to the next step, or to make the rehabilitation process effective, the family is very important. Generally, these are all the mediums I say occupational therapist uses: play, activities, and occupation. But imagine these mediums are not just for OTs, not just for any professionals, but can also help for the family to serve or for the family to address the rehabilitation need of the child. Whatever they want to achieve, there is always the play way of doing it, there are activities way of doing it, and then in the end, occupation, that is the ultimate goal with the children, is the target for us. So, as a parent, when we have a child with special needs, usually we go to the professionals, we go to a pediatrician, neurologist, and psychiatrist, get diagnosed, find out what is the problem, and then there is a whole bunch of coping mechanism involved, coping process involved. We sometimes we are upset, sometimes we are angry, sometimes we want to find out is there a cure for it, what is the reason for it, and trying to figure out why this has happened. Sometimes why this has happened to me, and sometimes why this has happened to the whole community as such. And all these are all settle down after some time once we are aware of what condition we are dealing with. Once our awareness is improved about the child, once we start understanding the child for what the children are, the involvement of the family in the actual rehabilitation process gets on the way. First thing for the family or for the parents to do in the rehabilitation process is get involved, be involved, don't stay away. It's not a professional's work completely to give you all the rehabilitation process if you just leave your child to the professional and then expect everything to get all right. And we usually don't do that also as parents. We definitely start working. But the clarity of what to work, how to work will come only when you get involved in the session. That means whenever the session is happening, whenever the treatment is happening, you talk to the therapist. Before the session, what is the goal setting? What are we going to work? What should I do at home? So the therapist will explain you, or the professional, any professional will explain you, this is what I'm going to work for your child. So I am doing this and you do this at home. So getting involved with the rehabilitation professional, getting involved with the process will help you understand better about the condition, at the same time better about what help or what contribution you can make towards the child's improvement. There comes the medicines next. Now, there is still a lot of debate going on between parents and professionals when it comes to giving medicines for certain issues. See, always remember that it's not always wrong and it is not always right. So when somebody is prescribing you medicine, take the medicine if that person is a professional, that person is a qualified medical doctor. Okay, and then don't go for symptomatic management. Generally, okay, if I take this medicine, this gets settled. When you take a medicine, what you have to do as a parent, you have to watch out for symptoms. You have to watch out for any changes in his behavior, in the child's communication, positively or negatively. At the same time, discuss with the remedial educator, discuss with the psychologist, discuss with the school teacher, and discuss with the therapist, and finding out how the child is performing after taking the medicine, or after taking the medicine 4 hours after, 6 hours after, or immediately after the medicine. Is there any improvement? Is the child getting better because of the medicine, or getting distracted because of the medicine? So this input from the parent, from the therapist, from the other teachers will help the medical practitioner to understand, is he giving the right dosage, or is he giving the right medicine? Does he have to change it? Sometimes what happens is the complications along with medicines will be more, that will disturb the whole rehabilitation process. That time the medicine has to be stopped. And sometimes the medicine will help the therapy process and will help the child to learn more information. So that medicine has to be continued for some time. And this is a teamwork, so it goes on from the therapist, from the parent, from the teacher, and to the medical practitioner. So they all have to work as a team, and in finding out what medicine, what amount of medicine, what time, and what type of medicine will help the child perform better. If it bothers, if it disturbs the child's improvement, obviously, yes, you have to stop the medicine. That also you have to give the input to the medical practitioner. And then work with your child's school. Always when you go to school, try to find out what and where are the areas we can improve ourselves, improve our child with. It can be a lunch time, it can be a playground time, it can be assembly time. Find out, figure out, go observe your child without the child noticing you. Stay from far and speak to the teacher every week, and figure out what else you can do to make sure the child is participating in the school. The child going to school is not the only goal for us. Of course, this situation, the children are not going to school because of the lockdown, but ultimately after everything gets over, we will be going to school. So the process or the aim for you is to make sure when the child is going to the school, or going, for this matter, anything, not just the school, not just the classroom, therapy center, or your family function or anything, make sure the child is able to participate in the activity like everybody else, at least to the maximum level. So that brings to the next point, where parent with purpose and warmth. As a parent, sometimes we are very strict and very harsh on our own children. And at the same time, sometimes we are very loose with the children, very lenient with the children. That both being strict and being lenient dilutes the whole process. We need to be in the middle. We need to be in the correct place, correct portion, correct amount of pressure towards our children, so that the purpose of making our children learn the new skill, the purpose of making our children behave properly in the class, in the public environment or in the family function, and the purpose of bringing self-confidence into our children, all served well. So parenting is not just simple. When you parent, you have to parent with the purpose, with the right amount of warmth. Then connect with others for the support and awareness. As I said before, all these points have always had one thing clear. As a family member, staying away from your child is not going to help. So be there, talk to the therapist, make connections with the therapist, talk to the teacher, make connections with the teacher, sports coach, swimming coach, or the physician. Whoever is involved in the rehabilitation process of the child, you have to keep talking to them. You have to make sure your points are rightly conveyed to them, and you also understand what they want to achieve with our children. So when we are in good communication with the professionals, we are aware of our child's positives and difficulties and challenges. Accordingly, we will be able to train our child in a better way. We will be able to help our child to succeed in many things without putting so much pressure on him. So how do we go about this? How do we go about helping our child performing better? Is if we understand, if we improve our awareness in what the child's condition is, what my child's personality is, what he can do and what he cannot do. Overall sensitization of the condition will give us tips in how to handle the child. This will improve the participation of the child in community or at home or family functions. The first thing in this whole of handling our children is communication. Now, communication, if we are open to communication, if you are free on our views, if you are able to tap into the aspect of the child, letting us know, because always remember, any child for that matter will always communicate. It might not be a language, it might not be by speech, it might not be by a proper body language, but there will always be a channel of communication open. Find that amount of communication, find that process of communication, and get involved with the child. So if you communicate correctly with the child, that means you're expressing it to the child is expressing it to you. You will be able to, understand the child better, because there will always be one way of the child expressing it to you. Be proactive, be receptive, go to the child, make sure you're listening so that the child will tell you. So your open-mindedness, your ability to go down to the child's level is very important. Don't expect the child to come and tell you things. You have to make sure the child trusts you and tells you things. So you have to go down to the child's level and make sure the child is free in communicating with you. That will solve most of the problems. Improve the social interaction as a family member. Train in social skills. How do we train social skills? As a family, you have lots of family members, neighbors coming in. So use those family members for making sure the child learns how to wish, how to interact with each and every relative. Each person has a different purpose in the family. So do they understand the roles and responsibilities of different persons in the family? And then interact with them. Ask the child to take a glass of water and go give it to Dada or go give it to Mama. Bring something from them, and when they come, taking blessings from them. Now, all these are all little social interactions. Then these small family, the close-knit family members, take the child out from the home. Out from the home is like towards the neighbors. When they go to the neighbor, the child can play with the other neighbor children, and then into the street, and then into the whole village. So you have to start from the family, stepping out and getting involved and accepted by others. At the same time, we also have to accept others, that they are going to not every time treat us equal, treat us kindly. There might be backlashes, there might be harsh words, but how to tackle them, how to explain them. Explain them is important, because one thing is, we also need to be in a level where we are not getting affected because of somebody else saying something, and interacting with them will make them sensitized, and then they will change the way how they are looking at us. So social skill training is very important. It starts from the home, reaches out to the community. Start saying social stories. Make the child say social stories. If the uncle comes home, he says a story, and then uncle tells the child to say the story to the grandfather or the grandmother or the aunt. Make use of different family members, different relatives coming in and taking their role and explaining it to them. So this is very important. This is so important that you need to be able to tell the stories to the children. At the same time, the stories will have values, the stories will have communication, the stories will improve on self-confidence, and the child will be able to withhold or able to tolerate the pressure from outside, at the same time interact with other people and express himself. Lots of receptive and expressive communication will happen through social stories. Circle of friends and mentoring. as a family member, we will always think that, only the father and mother is involved, the grandfather and grandmother who are not much involved, or if they are involved, they will probably spoil the child with too much of love and care. Here in this situation, what you have to understand is making sure the same age group, that is like 3 years younger or 3 years elder children, are together with our kid, and then they are able to teach him, because there is no better way of learning than being with the friends, being with the peer group. So same age children, we learn a lot. The parents can teach only so much, the teachers can teach only so much. Only the friends will teach you life lessons. So let's make sure we get right amount of friends, right kind of friends for our children. And we can obviously, yes, they are neurotypical children, we can tell them, okay, this is what I want my son to learn. So can you please teach it? Can you take him to the shop? Can you take him to playground? And obviously he will be getting hurt. He will be falling down and getting hurt. It's all right, because when he goes out with the friends, it is all right to get hurt, fall down, and then hurt himself, and come back and understand that, okay, these are all part of playing with the friends. And next time I should be very careful with my surroundings so that I don't fall down. This can only be learned through friends. This can only be learned when they are playing with the friends. So making sure they get a circle of friends and people who can mentor him, people who can guide him in the right way are around him. So this we need to make sure they get it. And what as a family can teach? Usually we say, teach the feelings in the classrooms, in the therapy center. But usually the therapy centers will not be able to teach the feelings much, but the family can teach very much. Family will be able to teach them the feelings, what is sadness, what is happiness, how to be happy, how to be sad, and how to overcome sad, how to console them ourselves. All these things can easily happen because so many family members around us. So you can teach them on learning to identify what is the feelings, what is sadness, happiness, frustration, anger, and anxiety, and then how to relax ourselves as a family. Sit together in a group, then just listen to music or somebody patting on the back, somebody giving a nice hug, warm hug. All this will help him to overcome and master the feelings, master the emotions, and then teach them anger management. Anger management in the family is important because if it is happening in the therapy center, what usually happens, like this is a therapy center, you will not be angry because we are the people who are telling them, no, you cannot get upset with us. We will show you who's the boss. We will put the child down. That's not going to be helpful in the long run. This will probably suppress the emotions. So in the family, what happens? In the family, if I'm also sad, you're also sad. Let's give a hug. Let's hug it out and solve it. All these things will help in sorting out the anger management. And then there is always a chance of expressing what I feel, what my emotions are. When I express, I am able to understand the feelings better, understand the emotions better. So you can always, this can be achieved through social stories. This can be achieved through communication with the family members. Morning, father goes to work. Evening he comes. He can tell whatever happened from the morning to evening in the to the father. See, all these things can happen well. So it will help the child to develop expressive communication. So all these things, feelings, emotions, communication, self-confidence, coping strategies, all these things can be taught by just training him in how to manage his feelings. When we want to improve something, increase the desirable behavior with the children, generally use the positive reinforcement. These are all comes under behavior therapy, and anybody can use these techniques. It's not like only one person has to use it. So, and most of the times as family members, as professionals, we are always using this reinforcement strategies. Oh yeah, very good, you did very nice, claps for you. Clapping is a reinforcement there. Clapping is an appreciation there. And then, okay, if you score 10 marks continuously, so if you score good marks continuously in all 3 term exams, final exam, I'll give you this. I'll give you a cycle, or I'll give you a laptop or a phone. No, or token system we are using. Prompting whenever the child wants to say something, we'll be like, oh, you mean the food? You mean what you had in the morning? Was it round? Was it white in color or brown in color? So we are trying to give them clues. We are trying to prompt the children, and we are trying to shape what they are going to tell us, what we want them to become. See, all these behavioral tactics are used, but as a family, it is very easier to use these strategies and make sure what positive behavior is encouraged and what positive behavior is expected in the family, because everybody is going to behave in certain way and our child will also follow. Simple example: if I want my child to drop the plate he had a dinner with in the sink, that means I also should pick up my plate and go drop it in the washing dish. So this way, I'm being a role model. I'm being a example for him, so that he follows me. He looks at me, okay, Papa is also doing this. Amma is also doing this. Brother is also doing this. So everybody is doing it. It's not one person you're instructing, okay, you only have to do this. When you don't do what you're teaching your child to do, the child will have a confusion. Why should I do it when everybody else is not doing it? No, there is no point. So whatever you want to teach the child, always remember, you have to be the role model. You have to be the one who should be teaching the child and making sure the child is following and helping him get the desired behaviors shaped appropriately. Sometimes, yes, there are behaviors which are not acceptable. Sometimes there are things which we don't want our children to learn or do. Then what we have to do is systematically ignore, systematically make sure that behavior doesn't appear at any point of time in life, and then divert them, give them time out, saying, okay, this is not acceptable. You're going to have a punishment for this particular way what you did. So this will help. But only thing here is, you have to be very consistent. All the time, you have to be consistent. Consistency is the only thing which will help you, making sure the child learns what you are teaching him. If you are not consistent, if you don't do it all the time the same way, the child will think, okay, every time he is changing his way of reinforcement with us, so I don't have to be consistent with him. So always remember, it is how consistent you are is how the child will learn the correct behavior. Generalize the behavior. Wherever it is learned, if it is learned at home, take him to the shop, take him to a social function, take him to a mall. Or in all the places, the same behavior has to be consistently carried out and generalized. After that, maintain it, practice it for so many times that it becomes a habit. And slowly you remove all your prompts, you remove all your reinforcements. So it happens a habit that without reinforcement, without you expecting him to do it, he will continuously keep doing it. Finally, there are some take-home messages. These are the ones which are actually important from my side. After this, obviously, yes, we will have a very detailed interactive sessions with you. Whoever wants to ask questions, you can ask on this aspect. See, it is important to recognize our child's difficulties so we know how to deal with them. How we will recognize the difficulties is to understand and to know what the condition is, what that particular condition has symptoms, how will it go, what will improve, increase the symptom or decrease the symptom. Based on that, set small targets and work consistently towards them. When you when you keep a small target, that means it is achievable. In therapeutic terms, in professional terms, when you set a goal, what we say is, for example, if the child is not sitting in one place, hyperactivity is more. The generalized goal can be reducing the hyperactivity. But reducing the hyperactivity is it a understand? Are you able to understand the goal? How do you reduce the hyperactivity? What does it mean by reducing the hyperactivity? How will you know it is reduced? You can say, no, sir. If he sits in one place for some time, I will consider it that as a reduced hyperactivity. But how long if he is sitting in one place is considered reduced hyperactivity? So your goal has to be very clear. No, the child will be able to sit for 5 minutes and involved in either writing or reading activity with minimal verbal or physical prompts. So it says clearly he should be able to sit 5 minutes. We should be able to control him with only verbal command or mild touching, and he should also be involved in a writing activity or a reading activity for that particular 5 minutes. And all these three things should be able to should be achieved within 2 months time or 3 months time. This is how you set a goal. So you set a small target and work consistently towards it. So you will know it. He is able to sit for 5 minutes. Okay. Next, the whole same goal will change into 10 minutes. Same goal will change into, instead of very minimal physical prompt, we are going to give no prompt, no help. If I ask him to go sit, do the activity for 5 minutes, he should be able to do it. So that is the next level of goal. Always remember, goal setting is important so that we don't get upset with things that, oh, no, we couldn't achieve so many things with him. This will give you an information where each child is different and each child differs in achieving that particular goal. And always remember, the child is a child. Have fun with your child. Enjoy with your child. Play with your child. Don't be very serious and get upset with your child in achieving that particular goal or thing. No, to achieve the goal, you have to be very friendly. You have to be having fun with the child. He's not a laborer. He's not a worker. So treat a child like a child. Don't expect him to behave like an adult because you are an adult. Or what we always do is like, no, you have to do like what I'm telling. And we will always tell the children as an adult. We don't think from the child's perspective. Always remember to treat the child as a child. So the goal setting usually is from classroom or school-centered goals. Now, because the schools are not there, you can set home-based, dinner-based, or prayer time-based, or meeting people and then that based. So your goal has to be fixed or focused on one particular area. That is when it will improve. Don't give a generalized goal. I want to improve this behavior when somebody is coming home. So that behavior alone we will work. Then generalize it to the other situations. So it's easier. Whenever we are in need, whenever you need to help, call up your therapist, call up your remedial educator and ask them, okay, I'm doing this. Am I doing correct? Can I send you a photograph or a videograph of what I'm working? Can you correct me if there is anything wrong? Or what is the next step? I have reached from 1, 2, 3, 4, 5. After 5, what should I do? Or I missed my 4 and then reached 5. Or missed my 5, I reached 6. What should I do? Should I go back to 5 or should I go back to 7? All these things, whenever you need a help, ask the professionals. They will be able to help you. Because it is a teamwork, always remember, he is not going to be the only one person, one-man army. You are not going to be the only one-man army here. We have to work together for the betterment of the child. So general do's and don'ts are, we are only here to help the child learn the particular skill. We are not here to do things for them. Because we want to attend a meeting, what we will do with the child is we give the phone to the child. And the child will be playing playing in the games or watching YouTube. And then they will blame the child. Okay, no. You only, the child is all the time in the phone. Who gave the phone to the child? You didn't give. No. If you didn't give, the child would have not even learned about the games or the YouTube. So always remember, you are here to help the child, not to help yourself in certain situation by teaching any bad behavior or a wrong behavior to the child. So child is the priority. If you are working with the child, keep away all your work. If your work is so important at that particular time, don't come with the child. Stay away from the child at that time, so that your behavior does not influence on the child. Understanding your child better will help the child function better, because your expectations will also be in a right path, and you will know what is expected out of the child, what is possible from the child's side. And understanding the condition and diagnosis helps you better. Be always a bridge of communication between the child, the siblings, the other relatives, the therapist, the medical practitioner. So, because you know the child better, you understand the child better, your communication abilities with the child should help the other professionals to understand the child and give right therapy, right help for that particular child. And whenever you know the child is able to do, and you know they don't need your assistance, remove your assistance, withdraw your assistance. Don't think you have to do everything because you are the mother, because you are the father, because you are the brother. It's not like you have to keep helping the child. You also have your own life. You have to live your life. For that, you have to be free of other responsibilities as well. And that means you have to improve the child's independence. If the child has to be independent, you have to take your support from the child. That is a little difficult from our side, Asian countries, that we always try to support the people. But it's okay. If you take the support away from them, they will learn how to live themselves, how to be independent within themselves. So when and how to remove that help or wean off the help is very important. Take the support of the therapist or the special educator when you need, like other professionals. Whenever the child is playing, the special PT is for schools, but whenever the child is playing, be around, observe what help he will need in that particular game. How can you make sure the child participates better? If he needs any extra input, does he understand the rules of the game? Does he have the motor skills to play the game? So that you can train the child in achieving those skills, so he can perform better. And don't get emotional with your kid. I know it is very difficult to tell the family member not to get emotional. Why I would say not to get emotional is, when we are emotional, that means either you are so angry or you are so in love with the child. So what happens when you are too much emotional? You lose control of your own emotional self, and then you lose control of the child. This is where things go wrong. When you want to teach a child particular skill, emotions takes a back step. Only your brain comes into the picture. Only your mind comes into the picture, because you want to teach the child what needs to be done. You cannot get influenced by the child is crying, or the child is upset, or the child is angry. And if the child is not doing, if you are getting angry, then why you can't do it at all, that means you're wrong. And if the child comes up, hugs and tells you, no, mama, this time leave me, next time I'll do it. Oh yeah, beta, you are hugging me nicely, so I will not let you do it this time, we will do it next time. So what happens, the child manipulates your emotions to get the better out of you. Do you understand? So it is important to stay in neutral position, so that we are here to help the child, not get played by them. And don't discuss anything about your child with other children. Don't compare with them, because most of the times, the issues are totally different, or what it looks outside may be similar, right? If a child is hitting his cheek, there are two children who are hitting the cheek, or like shaking the hands like this. It can be because of two particular reasons. One is visual seeking, one is proprioceptive and kinesthetic seeking. See, there are always different reasons. You understand what the reason is, then you will be able to perform better. So comparing and trying to figure out, oh, I did that with my child, so you also do this, is not going to help. But my child has this trouble because I couldn't help my this child. My child has this trouble, and find out that problem if your son also has it. If you find what the reason the child had it, then the therapy will fall into place. So this is very important. And when the child is aggressive or hurting you or hurting himself, make sure you have to protect the child. The child is the priority, and then protect yourself. So how it is done is hold the child's wrist here and then hold him like this. So what happens, the child will not be able to hurt you. Or if you hold the hands like this, the child will not be able to come and grab you or hurt you. They might use the legs. When they use the legs, take them close to your body and hug them from behind so that there is no movement happening. They will not be able to kick you or hurt you. Again, head. When you are close to the body, head is touching your chest, they will not be able to bring it back to the head. So you have to protect the child from getting hurt. You have to protect yourself from getting hurt. Ultimately, the family is responsible for shaping a child and influencing their values, skills, socialization, and security. These four skills are very important for any children, not just the special child, even for the regular kids. Teaching the values, teaching the skills, teaching the socialization. And security here is self-confidence, ability to believe myself, believe other people that I will not get harmed, and function better in the community is very important. These skills can only be taught or can better be taught in the family than the rehabilitation centers. Always remember, as a family, you play an important role. But having said this, the family comes into a very important situation where all the family members needs to be in one single page. They should be, the mom and the dad should be able to understand each other and be together in doing things with the children. If the child is doing an activity, mom is coming and working with the child, dad suddenly comes in and feels mom is doing something wrong. He cannot correct the mother right away. He can probably give a hint without knowing the child about his presence. So once the activity finishes, he and mom has to discuss. That means whenever you want to do something with your child, mom and dad has to discuss, okay, this is what my answer is going to be. This is what I'm going to do with my son. This is what I'm going to teach him skills. Do you have any problem with it? Because if the mom is teaching in particular way and then dad is teaching in particular way and the grandfather is teaching in particular way, the child is so confused. So all the family members have to be together. As I said, lifting the plate, dinner plate and putting it in the sink, to wash is important, because if the dad is doing, mother is not doing, or grandfather is not doing, that means the child is again getting confused. All the family members have to do what you want to teach your child. It is very important for the family to stay united, stay together in their thoughts, if not physically, in their thoughts on what they want to achieve with the child. So as a family, the family plays a very important role in shaping the skills learned by the child and teaching the child. You also have to work along with the professionals in getting a right amount of input. What is the right thing to do with do for the children? So always remember, we are all working as a team. Take help from other people and help the children better. And I think with this, I come to end of the presentation, and I'm open for questions. Please, we will make it as a more interactive sessions in that case.
Yes, thank you so much. It has been a very, very beautiful, discussion. And because of the time, pandemic, I think it was very, necessary for parents to know about these things. Till now, I'm the only parent, so I will be asking you some question to clarify my understanding and also understanding for others, because our parents basically watch these videos after the session who miss because of their offices are open, and this is the time many of them cannot make it. Of course, I'd like to thank you a lot, because why this is so important, because many parents have no idea what to do with our kids at home, especially in lockdown. And, you know, we don't know really, I mean, how long it will continue. This lockdown will continue. We are not sure. I mean, as we see the signs and symptoms that it may continue long time, maybe a couple of months or, you know, because the situation is not coming in control. Now, as you told me, I mean, I have got one question only that is in from one parent. I mean, she put it before. I mean, she didn't join today, but she did put it before about brushing, which is not related to our topic though. Okay,
Yeah.
but she requested the answer. It's a kind of brushing, as you said, that when we do the brushing of our child, so it is from the, you know, I mean, the up, down, or, you know, like it is a top, bottom, or bottom, I mean, top, which direction should go?
See, it is usually from up to down. It is always proximal to distal because the hair follicles grow in that pattern from up to down. Okay, so that is to calm the child. That is to settle down the tactile sensory system and make sure the hyper children are calmed down. So always it is this process. But again, the researchers have proven going against is also helpful because the amount of stimulation is more when you are going against the hair follicle growth. So down top is also helpful, but when you are trying first, always go this way because there is a chance of making the child more hyper if you do it in the down to up format.
Other way. Okay, okay. So it's usually, I mean, up, down.
Yes, up to down.
Not like down, up. Okay, okay. Thank you. From my understanding, as you said that, as we understood from your presentation, that we parents have a lot of things to do at home. Okay.
Yes.
Of course, our kids are missing school and center, but still we can make a proper environment at home, right? Which is some challenges we have. For example, as you said, the extended family. I mean, you know, as we understand that, you know, if we have more family members, it's more helpful for children.
Definitely.
But unfortunately, in many cities, now we have very nucleus-like families, very short families, and sometimes only the parents and kids, and sometimes even only single kids, right? So which is also a big problem. As you said that, I mean, we need to make a kind of teamwork, right? And we need to work and get help from professionals, maybe online support or talking to them, getting involved, like the school, their IEP. I mean, the IEP they follow in the school, right? Suppose the school is closed for 1 month, right? So 2 months. So we need to get in touch with them and continue our work. And we need to understand our kids. I mean, especially their emotion level, and because more we understand, more we can offer them help. And you know, this is really good thing that to teach them social skill training, you know, how to interact with family members and other people. So, and consistency, which is I think a big challenge for us, because many of us don't follow this. I mean, we do some task and then stop doing that, right? So the child gets the signal that I don't need to continue this, because we sometimes think that our children don't understand. I mean, our special kids don't understand what we do, but most of the cases they do understand. They may behave in a different way, but they understand our, I mean, nature or behavior. It is reflected in their activities that they understand our.
Very much.
Yeah, very
Yes.
much.
Because you know, staying as a family member together, like talking to each other before doing something with the child is very important. So that the child does not feel, okay, mom is doing something else, dad is doing something else. If they are being strict, both of them have to be strict only in that particular level. No, one person cannot be so strict, one person cannot be so lenient. You have to be in the same level so that the child follows. I said the consistency of the behavior will improve better when everything is in the same level. Otherwise, what happens, like this is like a balloon, right? You know, if the balloon's surface has to be in the same thickness all around the balloon. If one place is less, the air will escape from that side. The whole balloon will burst. That one point of weakness will spoil the whole system. That is why we say everybody has to be together in that process. You put away your differences and, you know, work for the child. The child is the priority. If we keep that in mind,
Child-centered, everything should be child-centered.
Yes.
So in that case, I mean, as I think many of us have this wrong idea that this is informal. As you said, I mean, I think then home activities should also be formal. For example, anticipating that this lockdown may continue a long time. If it doesn't continue, alhamdulillah, that's fine. But if it continues, right? Do you suggest us, like the parents, to, for example, sit down together, even with the help of the professional, for example, taking some online, okay, making a kind of group meeting that the father, mother, one or two occupational, one speech therapist, for example, one group meeting, and settle down some, like, ideas or kind of IEP kind of, schedule, a daily schedule, make it, and then start working with children. What do you think? Is it a good idea?
It is definitely a good idea. See, there are two things we can do. As you said, as a group, we can work out. We can plan individually also with the IEP and have something. See, IEP, as a family, you're going to work with your child. Group activities, as a group in one place, you come together, the children will also interact. But remember one thing, when you're coming as a group, bring in your siblings who are not special children.
Mm-hmm.
Because they also need to interact with other children who are neurotypical and learn from them. The games have to be inclusive and everybody should be playing. Parents, children, and fathers, mothers, everybody. So this helps. Fix a one place, one person's home, go sit in the hall, do that activity together. That will help the child to learn much better things. Imagine what if I am coming to your house and playing, then leaving. I'm learning about the topographical orientation, my visual perceptual skills, my gross motor skills, and coming and getting inside your house, I have to buy something and bring it to you as a social gesture. So I'm learning values. I'm coming inside, wishing you, taking my place rightly and sitting, learning values, how to behave in a public place, how to behave in front of the elders. And then I'm playing with my children. So I'm socially interacting with my friends. Then again, nicely getting dressed, wash myself, clean the place, and come back out and then going back home, remembering which way I came, which way I'm going back, time schedule, how long I'm here. So many skills, you will not be able to teach it in the therapy sessions, but you will be able to teach when you're going out for a play date. We call that play date. Go to another person's house and play, which is very important. 5 parents together, each week go to one parent house. Okay. Very simple.
It's kind of making a network.
Yes.
So the parents of special kids, they can make a network.
Definitely.
Okay. If not like many parents, but 3 or 4 parents, okay? And by rotation, they can visit each other's house.
See, this is a very important thing. After 5th week, they need to form the gang. They need to form the bonding. So they can keep continuing. After some time, break the chain and go to a different parent's house. Yes. So there are 2 groups meeting. Take a bigger place, common place, public place. Go and meet there and then come back. So the confidence of the children will improve.
Thank you so much. And because why I asked this question, many parents even ask us, I mean, what to do in this Corona time, this COVID-19, because we cannot go out. But as you said, and I know that most of the parents take online sessions. So why not like taking a combined session? We can request the occupational therapist and speech therapist. I mean, this is one idea, that occupational therapist and speech therapist at the same time, and one special educator, same time. Okay, we are taking scatteredly separate time, same time. Father and mother can sit together, make a I mean, kind of combined group meeting kind of thing. Okay, make a plan for 15 days maybe, or every 15 days or 3 weeks as prescribed by the therapist. They can sit for the follow-up meetings. What has been achieved, the plan like this. I mean, this is a good idea, because many parents, I mean, doing a lot of work, spending a lot of money, but the success is not coming because things are scattered, not in a planned manner. But as you said, that we need to make the plan and go forward. Dr. Murali, thank you so much, because I mean, this has been, especially in India, Bangladesh, the situation is getting worse and we don't know how long it will continue. And keeping children, even neurotypical children, it's not easy to keep them, And why do we blame our children? We do like to go outside. Even adults, we don't like to sit at home. though we have everything like television or Netflix or internet, but still we like to go out, right? So especially for our kids, it's a very tough time for them, especially big cities where they don't have enough parks or outing facilities now are restricted also. So thank you very much for giving us time in this very busy schedule, I know, and being staying with us. Your
Definitely.
advice has always been very appreciated, and the parents have been benefited because they basically watch the videos later in their convenient time.
Sure,
So
sure.
thank you
Definitely.
very much.
One last point I would convey is, there is something called the bio bubble. We are all restricted in this time, but if you are living in a same community, same building, there are, for sure that particular family is, that particular building is secure. Then those people can join together.
Okay.
That bio bubble we can make, but I know it is difficult. I know it has risks, but considering the situation, we can explore this only if the other family is also safe and secure.
Yes, of course. Yeah. I mean, according to the facilities available, also they need to be supportive as well. Because
Yes.
the fact is, unfortunately, you see that many families don't support such kind of families with special kids. Even many parents don't allow their neurotypical children to, I mean, like, go with, yeah, unfortunately, this is true. Okay. But there is exceptions as well. So as you said, but at least the special kids, I mean, and their parents, they can make bonding, they can make network, and that's why special childcare is working. Thank you very much for your time.
Thank
We will
you.
meet again, and we'll disturb you again and expect time from you again. So thank you very much. Stay well and especially stay safe. And we pray for you. We pray for all infected in India, Bangladesh, and in other countries. Okay, our prayers for them. May Allah make it easy for us and take it away from the world. Thank you so much, Dr. Murali.
Thank you so much. Thank you so much.